We're going to talk today about mental health essentials. So let's get into the agenda right away. So we're going to cover why mental health is so important right now and a little bit about mental health first aid. It's an acronym, MHFA, that you'll start to see more and more as mental health first aid becomes more a household word. So we're going to talk a little bit, maybe not in this order, but how to approach somebody that you may be concerned about. And we're going to go through specifics in anxiety and panic, depression, substance abuse, and we're going to have a little bit of time on suicide and how to ask that question so that you can help save people's lives. We're going to finish with a little bit of self-care. First, let me ask you this question. What do all of these people have in common? They have all come out and acknowledged that they have mental health challenges, be it depression, anxiety, or both, or some other things going on. So we can add to this group Michael Phelps, Adele, Prince Harry, Billy Joel, and Chelsea Handler. I just found out she's written a book about it, believe it or not. And so I'm going to go out and get that book. But what they are doing by coming out about mental health challenges is reducing the stigma. You know, we still have negative attitudes and beliefs in our world today towards those experiencing mental health conditions. So if you think about the messages that you've gotten about mental health, you know, I really started to think about, if you want to take a little history lesson, I'm going to make it really quick. In ancient times, it used to be thought of as demonic possession. And in the Middle Ages, it was still a sin or a possession. In Renaissance times, this is 15th to 18th century, mental health challenges, well, there was more of an interest in science and reason. So it was thought of less as a possession, but still the asylums that they had people go to were really harsh and inhumane. But then we come to the 19th century, and yeah, Freud is the guy, right? And he introduced psychoanalysis, changing the conversation to internal conflicts. In the 20th century, mental health advocacy, even through treatment centers, were still humane. Like there were lobotomies still. But now we're talking about mental health awareness, stigma reduction, and integrative care. There's a rise in understanding trauma, neurodiversity, and the impact of social determinants, yet there's still judgments from external sources. You know, you're weak, you shouldn't feel this way, suck it up, you'll get over it. So we are changing that by having this conversation right now. And so thank you all for being here. So the way you think about and frame mental health in your own mind will have a huge impact on everybody around you. This is a little bit about statistics. So employees with mental health challenges miss nearly 12 days of work a year, compared to 2.5 days for other workers. Employees experiencing depression lose 35% reduction in productivity, according to a survey from Modern Health. You know, before the pandemic, 1 in 5 adults in the US were known to have anxiety or depression. During the pandemic, it went up to 45%. And I'm not so sure it's come down, because now we're experiencing so much uncertainty day to day that 90% of the workforce says they're under stress. That's huge. So for women in construction, women experience higher rates of mental health challenges like anxiety and depression compared to their male counterparts. And here are the statistics. In 2021, 49.1% of women reported experience anxiety, whereas men, 28%. And 12.5% experienced feelings of depression compared to 8.9%. So it's, again, really important that we have this conversation. This is a slide that just shows that now we have 5 generations in the workforce, but Gen X and millennials make up the majority. It's no longer the baby boomers. But we know that 35% of baby boomers are willing to talk about their mental health challenges at work, whereas 66% of millennials and Gen X want to talk about it at work. So it's really important to meet the needs of changing workforce. I'd like to play you a video now. And, we have a way of socially interacting that's automatic in our culture. Even though I know this still happens to me all the time. I meet up with somebody and say, "Hi, how are you?" And they say, "Fine, how are you?" And we go back and forth, right? And it's just automatic. But what if somebody said, "I'm not doing so well"? Would you know how to respond? And so here's a video. It's put out by the National Council for Mental Wellbeing on how to have that conversation.
I'm Danny. I've lived with depression and anxiety for about 12 years. And today I'm going to be opening up about those mental health challenges with some complete strangers in the hopes that we can start normalizing conversations about mental health. Hi, I'm Danny. Nice to meet you.
I'm Colleen. It's nice to meet you too.
Cecilio, nice to meet you.
How are you?
Doing well, thank you.
I'm doing really good. Yeah.
Doing good. Yourself?
I'm actually not doing so well today.
Okay, that's honest.
Oh, it's all right.
Okay. So,
Okay.
Okay, what's going on?
can you tell me a little bit more about it? Do you feel comfortable talking about it, or?
Yeah, I can talk about it. So I've been living with depression for a long time, and this week has been particularly hard for me. So a lot of people simply just don't know what to say and what to do when somebody opens up to them about a mental health or addiction challenge. And that's really where mental health first aid can be valuable. It teaches people a concrete action plan for starting a conversation and getting somebody the support that they need, whether that's treatment or just a non-judgmental listening ear. So was it a little unexpected when I responded that I wasn't doing well, us being complete strangers until this moment?
I'll be honest, it caught me off guard.
Yeah.
You just expect the automatic response of, how are you doing? I'm good.
When you first meet someone, here there's like a huge distance.
I always feel like, how can I help someone else? So, and I know it's hard because you just want to be like, oh, sorry, okay, let me run,
And I don't think people do it because they're inconsiderate. I think it's because they honestly just don't know what to say.
Have you talked to anyone about this?
Sometimes I just don't want to burden. Yeah.
I know it feels like that, but most of the time people want to help.
Yeah.
Like everyone kind of wants to be useful to other people, so they want to help you. So
Yeah.
don't feel like you're burdening them.
That was really nice.
That's so sweet. I totally wanted to give you a hug, and then I was like, that might be weird, but okay.
No, that was exactly what you should have said.
Myself, I was thinking okay, this person is in need of help. Try your best. Listen to them. Sometimes that's the best thing you can do is just listen.
If you had cancer, you wouldn't just try to you wouldn't will yourself to get better with that. And so I hope that people just start talking about it more.
Wouldn't it be refreshing if we could take off the mask?
Yes, absolutely. Be real people.
So how did you learn how to respond that way?
My father committed suicide when I was young, and it was like a really pivotal change. And I think I spent most of my life trying to avoid that and avoid talking about that and the shame and the guilt. So I really made this decision to learn how to interact with people and be empathetic and show people that someone does care about them even if I don't know you. I think people should just ask more questions, because it's once you get to know the person and understand that it could literally be any of us, any of us could have this at any point in our lives. How could you make a judgment on it?
Can I give you a hug?
Well, absolutely. I love hugs.
Thank you.
So a little bit about mental health first aid, because it is a movement that started in Australia. It's a global movement. Countries license the curriculum, and here in the United States, the National Council for Mental Wellbeing has licensed the curriculum and then teaches instructors how to teach it, as well as certifying mental health first aiders, lay people. It's the initial support that's given to someone who's going through a mental health, substance abuse, or crisis before a professional takes over. So it's an 8-hour certification. It's like CPR, but for mental health. And it teaches you how to recognize someone's going through a mental health challenge. And just as CPR has the ABCs, airway, breathing, and compression, mental health first aid has ALGE. So it starts out with how to assess and approach somebody who you're concerned about, how to assess if there's a risk of suicide or harm or a mental health situation, how to listen non-judgmentally, that's the L. The G is how to give reassurance and information. And you know, this might be the listening non-judgmentally and giving reassurance and information may just be the most important thing that you can do to have a conversation with somebody. Then we encourage professional help as well as self-help and other support systems. So learning to listen is a huge piece, as well as giving reassurance and information. So I had a situation where a member of one of my groups lost her brother unexpectedly, and she went to the funeral, and a couple weeks later when she got back, I called her up and she was just sitting there and she said, you know, I can't think. I can't get done what I usually have been able to get done. So I was able to say to her, that sounds like grief to me. It sounds like what you're going through. I'd be surprised if you didn't go through that. And she felt so reassured. A couple of months later, she said, you know, when you said that to me, it really made a difference. So just listening and giving reassurance is really important. So the most prevalent mental health disorders are anxiety and major depression. I think it's really important to notice how much more prevalent anxiety is than any of the others, right? Today, we're going to go through a few of these. We're going to start with anxiety because it's so common. You know, we need fear to keep us safe. It keeps us alive biologically. If we didn't have fear, we would have been extinct long, long, long ago. The saber-toothed tiger would have gotten us. Now an email can get us, right? So it's just important to know that we are, I don't want to say fighting with our biology, but we are coming close to working with our biology when anxiety comes around. So we have to soothe our own nervous system when that happens. Breathing is always the best thing there. So a panic attack is a little bit different, and in the sense that it's so intense, it often feels like somebody's dying. Feeling of not being able to breathe, chest pains, racing heart, disoriented, maybe a loss of control. And if somebody's never had a panic attack before, it feels like they're gonna die. So I wanna say out loud is that one of the first things I learned when I learned to teach mental health first aid is that it is always okay if you're with somebody who is having some kind of panic and they can't breathe and they think they're gonna die, it's always okay to call 911. And no one has ever been shamed before when it was a panic attack and not a heart attack. But it could look like a heart attack or an asthma attack. So you want to approach somebody by saying, has this happened to you before? Because if it's happened before, they probably know they're having a panic attack. And then you want to ask, what's worked? Okay, let's do that. So let's talk about depression, another one of those at the top of mental health challenges. Is described as a feeling of sadness or loss or anger that interfere with your everyday activities. Some of it can be chemical, some of it, I mean, brain chemistry, some of it can be situational. I think we as a culture have pathologized sadness. So when we talk about some of these signs and symptoms, these symptoms, in order to have a real, not that we're diagnosing because we're not, but if this situation lasts longer than 2 weeks, the person really does need to seek help, either a therapist or a support group. But people are more likely to go to their doctor and talk about mental health stuff than a therapist, go figure, I don't know. But that's always a good possibility. So signs and symptoms, if you have difficulty sleeping, changes in appetite, difficulty getting out of bed in the morning, difficulty concentrating, you know, how you might see somebody is a loss of interest in the things that they used to find enjoyable, the inability to complete usual tasks and activities. Maybe they're disheveled, they're not taking care of themselves in the way that they used to be. Feelings of irritability, frustration, or restlessness, and those kinds of things you really have to ask and get involved in a conversation. So if you see that happening in one of your friends or somebody at work, you always want to approach with care and concern in the way of, you know, I'm noticing lately, using I statements, of course, I'm noticing lately that you seem a little off. Is something going on? Or I'm really concerned about you. You know, you're not doing the things that you used to be doing and that you love doing. So when you approach somebody who, for any mental health challenge, you always want to approach them in a private location, not in front of a whole bunch of other people, right? But just the two of you. And only approach if you have the time to get into a conversation. I think it's really important that you have the time, because to start a conversation like this and then disappear may not be the best thing. So asking, can you tell me more about it? Open-ended questions. And I really want to know. So letting the person know that you care. Who's there to support you? Have you spoken to somebody about this? One of the things that we know is very prevalent in the construction industry is addiction. According to the American Addiction Centers, the construction industry ranks 5th in illegal drug use, 2nd in both heavy drinking and substance use disorder, and 1st in heroin use and pain reliever abuse. So opioid use and abuse has been especially challenging in construction, as I'm sure I'm preaching to the choir, but when somebody gets injured, workers are often prescribed opiates for pain relief, and the research is showing that around 15% of individuals that take the drugs become long-term users. So yeah, it increases their chances of developing an addiction by more than 10 times. So abuse is defined opioid, alcohol, illegal drugs, prescription drugs that interferes with your work, school, or home. You know, and there's also functional users, people who are using substances, but they can still function. It's the beginning of, it can be the beginning of a concerning issue and can lead to abuse. Giving up or reducing activities, again, could be because of drug use, taking risks, sexual risks, driving under the influence, those kind of risks. So it's just important for you guys to know that happens, right? So sometimes substances are often used as coping mechanisms for an underlying mental health issue. In my training, they would say that if somebody's recognizing they are abusing substances, it takes 6 months of being sober or clean in order to really diagnose what's going on with somebody underneath it all. So, and substance use disorders are preventable and treatable, and early intervention is critical. All right, this is a really important subject, and because likely suicide has touched your communities, your families. So if I want to give you some information about suicide and how you can recognize it and how you can approach it, if there's somebody in your world that you're concerned about. So we know 988 is now the new number. Well, it's a couple years old now for crisis line, and there is a text that you can use. It's 741-741, because a lot of people don't want to call and actually talk to somebody. And they, depending on where your area code is from, is where they're going to route you to. So if you're living in a different county or a different state in the United States than your phone number is, they're going to route you to that state, but they can always send you to the right area. And there are counselors there who will talk to you. And they will, this is a number that you can use as somebody who's concerned about someone who might be considering suicide, as well as to help somebody who might be considering suicide. So here are the warning signs of suicide: talking or writing about death, dying or suicide, threatening to hurt or kill themselves, looking for ways to kill themselves, sleeping too much or not at all, and when there's a feeling of no purpose in life, and thinking that there's no way out of a bad situation. One of the things we want to do is be careful of our language when we talk about suicide. We want to start to say died by suicide rather than committed suicide. Because again, the word committed is associated with a sin or a crime, and in some places it's still a crime. So again, we want to remove stigma from our language, and we want to, it's a really tough question to ask. Are you thinking about suicide? But so you can have anxiety as you're asking it, but you want to appear like a duck on a pond, right? Moving along easy, and that underneath the pond, you're like having your own thoughts. So if you want a direct question, if you want a direct answer, you must ask a direct question. And it's not a conversation we have in social situations, so many people feel uncomfortable, but it is really important to ask. We actually train for this in our mental health first aid class, but I want to give you just a heads up about the first thing that you want to ask are you thinking about killing yourself? And are you thinking about suicide? And there's a myth that you're going to put that thought in their head, but you're not. If they're thinking about it, it's already there, and they probably want to talk about it. So if they say no, something's up because you've had the occasion to ask about it, and you want to get the person as much help as possible. If somebody says yes, we want to ask these next 3 questions. Do you have a plan? Do you have the means to carry out the plan? And do you know when you might kill yourself? And using those words is really, really important, rather than are you thinking about harming or hurting yourself? Because you've got to be clear when it comes to this. So again, you never want to leave somebody alone if they have a plan. You always want to have somebody there with them. If it's not you, somebody else. And you can also call 988 for help for yourself about what to do next. Some people, you'll never know that they were thinking about it, and so you never want to act alone when you're talking about suicide. It's a sensitive subject matter, and I just think it's really important. We want to empower you to ask the question, because you can save lives this way by just asking the question. Let's talk about self-care, my favorite subject. What do you do to take care of yourself? How do you do your own self-care? Making it a practice of taking action. So the idea here is to put on your own oxygen mask before you're helping somebody else, right? To take care of this first. The normal thing is to get regular exercise, to eat healthy, to make sleep a priority, to try a relaxing activity, to set goals and priorities, and practice gratitude. That's a good one too. And stay connected to people. That's so important. But I want to take a step back, because First, it's important that you're mindful of your own internal experience in order to help somebody else. Being kind and having self-compassion so you can genuinely help somebody else. I like to call it catch it, name it, and tame it. So many of us are not taught a feelings vocabulary, and we're encouraged to push down our feelings. It's not okay to have those feelings. So I like to think about feelings as data. It's information that will tell you something about something that's going on. And if we're pushing, a feeling of sadness or a feeling of anger away, we don't explore it. And so the world of mindfulness trains us in a non-judgmental awareness. It's not always easy to check in with yourself first. How do you usually respond when you're angry or sad or scared? Knowing yourself and being able to catch what you're feeling, knowing your inner landscape will bring awareness to that place inside you. That will help you recognize it in somebody else and name it for somebody else. The next piece, so there's catch it, knowing yourself, then there's name it, but there's 5 feeling families: sad, angry, fear, joy, and disgust. And if you can just find one of those 5 words to name it, because if you don't name it, there's nothing you can do about it. And then once you've named it, we can tame it. We can do whatever we need to do. If there's somebody you need to talk to them. If it's just something for yourself to do, like deep breathing, just finding different ways to self-soothe. And having a normal practice like we were talking about of self-care regularly. So when the stuff hits the fan, which it will in our world, you have a habit to go to rather than our automatic thinking habits. So catch it, name it, and tame it. A really cool self-care thing. So I just want to then tell you a little bit about mental health first aid, a certification for you or your staff that lasts 3 years. It's an 8-hour training. The cost is $150 per person. So that you know what it is, there's 2 hours of pre-work and then a 6-hour online session, which we can split up into 2 3-hour sessions. It's very interactive with scenarios and videos. And we teach how to use the steps of algae to help somebody when they're in need. We go through early signs and symptoms, worsening signs and symptoms, and crisis situations. We cover panic, depression, substance use, psychosis, non-suicidal self-injury, and suicide.